Welcome again to the First Aid Show. Now, I was having a discussion recently with some first aid instructors, and they were asking me, well, we know we had questions from people, and we always look at these questions, and one of the questions was, well, why do we have to keep talking to the patient? You know, if you're just going to be talking to someone, you just tell them what's what. Why do we need to keep this communication going the whole time? Now, what you say will affect how they react. So what we need to do is we need to keep talking to the patient to keep them calm. Also, by keeping them calm, we reduce their breathing and their heart rate, and we can get them a lot more trusting in us. Sorts of things we want to do is tell them what happens, take some worries away from them. So it could be things like telling them what to do and what you are doing, so you're not getting any surprises. If you're applying a dressing on somebody, then tell them what you're doing and why you're doing it. Keep asking them if they're okay. If you're talking to someone, then it's quite easy for that person to communicate back. It does take their mind off of what's actually happening, and also they understand it a little bit more. Also, the more talking you do, the more information you get back. So you can ask people about their personal, their holidays, or their dogs or cats or whatever, but all this sort of information is good to gain trust and get more information from them. Hopefully then, what they're going to tell you is when you ask questions about their signs and their symptoms, they're going to give you a lot more information. Also, the hearing is the last thing to go. Now, some people say, what's the point of talking to someone who's unconscious? Well, they may be unconscious, but hearing being the last thing to go, they may still be able to hear you. And just hearing your voice will calm them. And it will just be quite a lot of effect. I've seen this firsthand with some of the stuff I've done. People can still hear, although they would appear to be unconscious. Taking that to the next level, if you're doing CPR, is there any point in talking to people? Well, yes. It is a sort of bedside manner in the sense that you are communicating, but also you're telling people around what's actually happening. So this communication thing, you're treating people with great respect, you're talking to them, you're ensuring that everybody around knows what's going on, and hopefully, this is going to help them. Even if people don't answer you, just keep talking. The thing is keep this communication. The person may be embarrassed, they may be worried, just try and reassure them as much as possible. Remember, what people are telling you, it may well be personal to them, so be careful what you're repeating out to others. Obviously, some information you may need to pass on to emergency medical services. Now, bedside manner within first aid is very, very important. And just remember back, you've got maybe a kid falls over, all that kid really wants is to be, told it's going to be okay. Well, this applies to first aid as well. Everyone wants to be told they're okay. They want to know what's going on. They want to know the emergency services are coming. So the more you can discuss it with people, the easier it's going to be for the patient. And hopefully, it will reduce their stress level a little bit before the emergency services arrive.